Hi everyone, Andrew Johns here with another update for you from Coastal Front. In this video, we are going to highlight the vaccine debacle here in British Columbia, the poor policy decisions of this current NDP government, and how they can fix this mess. So let's begin with the vaccine rollout. Initially, the BC government decided to limit the vaccinations to those most at risk. This included long-term care residents and their staff, COVID war healthcare workers, and remote and isolated Indigenous communities. Now, this made a lot of sense for two primary reasons. One is these groups were most likely to contract COVID-19 and possibly die from it. And number two, we didn't know back in December of 2020 how many vaccines were going to be received here in British Columbia. We've spent the last few months getting those most vulnerable vaccinated, and that's a really great thing. And I applaud the government for getting that done. However, here we are now at the end of April, and despite the near lockdown measures that were recently implemented by Adrian Dix and Dr. Bonnie Henry over 3 weeks ago, we're still seeing cases and hospitalizations rising. So what are we doing wrong? What this government needs to do at this point is get these vaccines into the arms of as many people as possible. That's how a successful vaccination program works. So how do we do it? Very simply, we follow other jurisdictions that have figured this out, like California and Texas. I call it the big box retailer program. John Horgan, you need to pick up the phone and call the CEOs of Canadian Tire, Walmart, and Costco and let them know that you expect them to give up 50% of their parking lot capacity to roll out a vaccine supercenter program. Then send a text message to every British Columbian like you can, informing them that starting in 2 weeks from now, these centers will be available and up and running to get everybody free vaccinations. Simply put, more vaccines into the arms of people means less viruses spread. Now let's move to the 3-week circuit breaker policy. First, stop it with these 2 and 3 week shutdown announcements. Do you realize that this BC government has basically never held any of these dates that they've proposed? They've always pushed them out further. They keep stringing British Columbians along, and frankly, we're quite tired of it. Don't set dates on lockdown measures you know you're not going to be able to commit to. Secondly, BC is operating in what I call a data vacuum. Other than new cases, hospitalizations, and deaths, we've never heard Dr. Bonnie Henry or Adrian Dix provide any empirical data to back up their policy decisions. Let me give you an example. On March 30th, Premier John Horgan was quoted as saying,
"The cohort from 20 to 39 are not paying as much attention to these broadcasts and, quite frankly, are putting the rest of us in a challenging situation. But my appeal to you is do not blow this for the rest of us."
Indoor dining was, of course, closed the same day with the hope of decreasing the spread of the virus. Essentially, what John Horgan was saying was this: young people are socializing, so we're going to shut down restaurants, bars, and pubs. But here's the problem, John. The cases haven't dropped. In fact, they've kind of still been going up, and it's been 3 weeks. The reason is these young people are still socializing. And honestly, I don't blame them. They've been through this, like every one of us, for an entire year, except they're the ones that probably had it the hardest. These are the time in their lives when these young people should be out socializing, spending time with their friends, and making out. And they're not able to because we aren't giving them the opportunity and they've fed up. So if you want to vaccinate anybody, actually, you should be vaccinating those young people who are going to continue to socialize. And in the meantime, open the restaurants back up, because those people who've been putting all that time and money into their restaurants and their businesses to make it safe for everybody, you haven't proven to us that COVID cases are rising in restaurants and bars and pubs. So get those open back up before many of these business owners go out of business permanently. As I've said before, this BC government could do itself a hell of a favor if it would just back up its policies with some evidential data. Once again, my question to our friends playing God in Victoria is simply this: do you have the data or do you not? It seems to me either way, you're keeping the rest of us British Columbians in a data vacuum. To finish, I want to lay out some compelling data that we've pulled directly from the BC Centre of Disease Control. This data goes all the way back to January 15th of 2020, and as I mentioned, this comes directly from the BC Centre of Disease Control. For the age category of 0 to age 59, they represent 74% of the British Columbia population, yet they represent also 84% of all COVID cases, but only 6% of all deaths. In fact, if you look at all the people in ages 0 to 59, their chances of surviving COVID-19, if they get it, is 99.91%. This is the majority of the working population and the population who are out going to restaurants, bars, pubs, staying in hotels, having fun activities, and going skiing. By contrast, people ages 80 and above only represent 5% of the population. They only represented 4% of cases, yet they represented a whopping 66% of all deaths in BC. But even after that, this group of individuals had a 77% chance of survival with no vaccine, and 87% of these people are now vaccinated. So my message to John Horgan is this: number one, roll out a mass vaccination program now. Call up Walmart, Canadian Tire, and Costco and let know you're coming. Number 2, start collecting data and releasing it to the public. And number 3, open the economy back up. Because at this stage in the pandemic, when death rates are near 0%, people's mental health and pocketbook are what's most important now. Make sure you subscribe to our YouTube channel. Thank you for listening. We'll have more as things unfold.